Chapter 5. Cleaning Tasks in Home Care. Outline. 1. Introduction. 2. Role of Home Health Aide. 3. Principles of Safe Home Environment. 4. Procedure, equipment, and supplies for household tasks. 5. Washing and drying dishes. 6. Laundering household and personal items. 7. Organizing household tasks. 8. Conclusion. Cleaning tasks in home care. 1. Introduction. Home care entails maintaining cleanliness and safety in the home. A clean home prevents accumulation of dirt, which could be a health hazard, and reduces chances of getting infection. This essay describes the role of home health aide in maintaining a clean, safe, and healthy environment. The essay further talks about principles of safe home environment and procedures for household tasks. It explains how to clean utensils, linen, and personal items. Guidelines on organizing the household tasks are discussed in this paper. 2. Role of home health aide. Home health aide gives safety, cleanliness, and health assistance by giving personalized care, checking for physical dangers, and report to medical authorities about the client. By helping in bathing, dressing, and toileting, they reduce the chances of discomfort and infections. Prieto, 2008, page 184. Assistance in movement, taking medication, and feeding reduces accidents. Purchasing, preparing, serving, and feeding ensure the client remain healthy. In some cases, the home health aide educates the client and family, which facilitate their cooperation when it comes to maintaining a safe, clean, and healthy environment. Home health aide gives support to client and family by ensuring the surrounding is comfortable and can allow safe mobility. Aide, 2009, page 46. 3. Principles of Safe Home Environment. To maintain a safe home environment, avoid objects that could cause stumbling. One can put handrails or bars in the house for support. Cabinets with dangerous substances and tools should be locked. Allow temperature for water heater to be adjusted to prevent burns. Naked flames should not be left unattended. Moreover, ensure there is an equipped first aid kit and functional fire extinguisher ready and accessible. Communication should be encouraged. A safe environment will ensure that there is no risk of burns, drowning, choking, cuts, falls, loud noise, falling objects, broken items, robes, and naked electric wires. It may be necessary to implement a system of monitoring movement, like a door alarm, bell, or supervision. Ensure there is a working telephone in case of an emergency. The home health aide can practice appropriate body mechanics when moving, lifting, and transferring client. Birchinall and Strait, 2003, page 4. In addition, cover the mouth when coughing and wear a mask if the client is coughing frequently. Avoid sitting or standing too close to the patient when they cough or have the flu. Ensure there is ventilation to allow flow of fresh air. Soiled cloths, linen, and items should be kept away from the clean ones. They can be kept together in a room. The soiled linen can be wrapped so that the soiling is at the middle and does not spill. 4. Procedure, equipment, and supplies for household tasks. Leahy et al., 2008, page 17, point out it is necessary to collect and get the right equipment and supplies to protect self and to avoid infection when cleaning. Household equipment and supplies required include broom, mop, dustpan, disinfectant, bleach, rag, scrub brush, vacuum, and scrape. Infection control measures should be considered in every procedure. Wear gloves when performing tasks and handling soiled linen, equipment, or clothes. Clean hands regularly, preferably before and after completing tasks. Separate dirty and clean areas. The bathroom should be cleaned with cloth and the toilet wiped with a disposable cloth. When cleaning the kitchen, start with the top to the bottom. Wipe spills and throw garbage daily. To clean the bathroom, cleaning starts from top to bottom, then clean sinks, shower, and then the toilet. The floor and the water spills should be cleaned last. To clean the living room, begin with vacuuming the carpet. If there is no vacuum cleaner, sweep the carpet with a brush, collect garbage, and throw it in a dustbin. Loose rags can then be tacked. Dust and wipe the furniture or items and return them to original place. To clean the floor, sweep first, then mop, and finally dry the floor. 5. Washing and drying dishes. When washing and drying utensils, it is important to establish if there is any utensils that need sterilization. Those that need regular cleaning should be kept together. To begin the cleaning process, gather all the utensils and equipment for sterilization. Get plenty of water, soft cloth, and soap. Sort the utensils according to type and dirt. Clean hands and wash less dirty items first. Wash one item at a time. Avoid overcrowding the utensil because it can cause glass to fall and break. Clean utensils in warm soapy water using a soft dishcloth. Rinse the utensils in clean water. Place them in a utensil drying rack and leave them to drip dry for a while. Wipe with a clean dry cloth and place in appropriate place. If the utensils were to be sterilized, clean and place them in a clean pot with cold water. Place the glass at the bottom and avoid overcrowding. Close the top and heat until there is steam. Let the steam sterilize for the next 20 minutes. When the heat is put out and the steam is no longer there, open the lid. The lid should be open only if the steam has dispersed. Remove utensils using tongs. Keep the sterilized equipment away from the other utensils that are unsterilized. Rice, 2006, page 85. 6. Laundering household and personal items. Rice, 2006, page 89, indicates that when laundering household and personal items for a client, wear gloves before beginning the tasks. Sort the soiled and unsoiled cloths and linen first. Get information if the cloths or linen are to be washed using a machine, and get the instructions on how to operate it. If they are to be hand-washed, it may be necessary to consider wearing gloves and using the disinfectant. Empty any contents that may be found in the pockets. Then sort the cloths and the linen according to color. Some cloths and linen can be cleaned separately if soiled or delicate. Then find out about drying, if to be air-dried or to be dried using the drying machine. 7. Organizing household tasks. Household tasks can become overwhelming if proper planning is not done. Begin with a list of household tasks. Then the tasks can be sorted and arranged according to time. Activities can be grouped into daily, weekly, and monthly tasks. For example, vacuuming can be done weekly, paying telephone, water, and electricity bill monthly, and buying medication upon advice. The rooms can be cleaned once a week. After arranging according to time, remove and reduce the unnecessary tasks. For instance, the dishes need more time for cleaning than the fan. Some duties can be designated. If the tasks are too many to handle, one can ask for assistance. This will ensure that all prioritized and necessary tasks are completed. Practice what is in the plan and make adjustments where necessary. When a routine is maintained and adapted, household tasks can be accomplished. Gingerich, 2008, page 163. 8. Conclusion. To create a safe, clean, and healthy environment, the home health aide practices personalized care and hygiene in giving care. They use body mechanic skills to move patients and educate family together with the client for them to assist in the cooperation of maintaining a clean, safe, and healthy environment. Cleanliness is maintained for comfort. Assistance is given in feeding and medication. A safe environment is maintained by eliminating any danger. The home is cleaned using bleach, a broom, dustpan, scrap, mop, disinfectant, vacuum, and rag and scrub brush. Utensils are washed and dried or disinfected. Linen and personal items are sorted so that the soiled ones are cleaned separately. To organize household tasks, a list of all work is written. The tasks are arranged according to time and the less necessary tasks omitted. Help when there is a lot of work is needed. The plan is followed and adjusted accordingly. Sample Home Health Aide Test Questions. 51. All human beings have the same basic physical needs, which include A. Food and water, B. Activity, C. Sleep and rest, D. All of the above. 52. One of the following is not a psychological need. A. Love and affection, B. Shelter, C. Security, D. Self-esteem. 53. A system of learned behaviors practiced by a group of people that are considered to be the tradition of that people is called A. Actualization, B. Tribe, C. Culture, D. Precision. 54. Blank is the name for the condition in which all of the body's systems are their best. A. Homeostasis, B. Metabolism, C. Peristalsis, D. Arthritis. 55. Which of the following is not a system of the body? A. Endocrine system, B. Diving system, C. Urinary system, D. Nervous system. 56. When outside temperature is too high, the blood vessels A. Constrict, B. Becomes excited, C. Dilate, D. Shortens. 57. Which of the following gives the body shape and structure? A. Apocrine and eccrine structures, B. Veins, C. Arteries, D. Bones and ligaments. 58. The nervous system controls and coordinates all body functions. A. True, B. False. 59. The taking in, breathing in, of oxygen by the body is referred to as A. Inspiration, B. Expiration, C. Purification, D. Exchange. 60. The largest system organ and the system in the body are the A. Mouth, B. Skin, C. Esophagus, D. The small intestine. 61. One of the following is a common musculoskeletal system disorder. A. Nephrotic syndrome, B. Histoplasmosis, C. Pneumonia, D. Osteoporosis. 62. The digestive system is also called A. Respiratory system, B. Gastrointestinal tract, C. Metabolic system, D. Nervous system. 63. The two major functions of the gastrointestinal system are A. Digestion and elimination, B. Digestion and locomotion, C. Elimination and respiration, D. None of the above. 64. Endocrine glands secrete A. Hormones, B. Enzymes, C. Lipase, D. Amylase. 65. The sex cells are formed in the male and female sex glands called the A. Gonads, B. Androgens, C. Estrogens, D. Lymphatic. 66. At age 1 through 3, toddlers learn to A. Choose education, B. Speak, C. Prepare for retirement, D. Develop language skills and vocabularies. 67. Blank is a disease or condition that will eventually cause death. A. A recuperating disease, B. An acute condition, C. Reproductive system, D. A terminal disease. 68. The term for the special care a dying person needs is called A. Skin care, B. Hospice care, C. Recuperation, D. Advancement stage. 69. Which of the following is not included in the normal changes of aging? A. Incontinence, B. Immunity weakens, C. Appetite decreases, D. Short-term memory loss occurs. 70. Common disorders found in infancy period include A. Prematurity, B. Low birth weight, C. Sudden infant death syndrome, D. All of the above. 71. Which of the following are the basic body positions? A. Supine, B. Lateral, C. Prone, D. All of the above. 72. One of the most important things to consider when transferring a client to a chair or a bed is A. Safety, B. Nutrition, C. The family, D. Finance. 73. Contractures are generally caused by A. Exercise, B. Driving, C. Locomotion, D. Immobility. 74. Pulling a client across sheets can cause A. Fluid retention, B. Shearing, C. Spinal cord damage, D. None of the above. 75. Blank is a device such as splint or a brace, which helps support and align a limb and improve its functioning. A. Leaning table, B. An orthotic device, C. Hand roll, D. Head pillows. 76. Hygiene and grooming activities, as well as dressing, eating, and toileting, are called A. Activities of daily living, B. Recreational activities, C. Indoor activities, D. Unhealthy lifestyles. 77. Oral care should be performed at least A. Once a day, B. At bedtime, C. Twice a day, D. None of the above. 78. Blank is the inhalation of food, fluid, or foreign material into the lungs. A. Expiration, B. Inspiration, C. Aspiration, D. Asphyxia. 79. Moving a body part towards the midline of the body is referred to as A. Supination, B. Phonation, C. Rotation, D. Adduction. 80. One of the following is not done if a client starts to fall during a transfer. A. Try to reverse or stop a fall, B. Widen your stance, C. Call for help if a family member is around, D. Do not try to reverse or stop a fall. 81. Blank is the impairment of physical or mental functions. A disability. B, burn. C, neuralgia. D, heart failure. 82. A fallacy is A, an option. B, truth. C, being sure. D, a false belief. 83. Which of the following can cause mental illness or make it worse? A, heredity. B, stress. C, environmental factors. D, all of the above. 84. Sadness is the only one symptom of A, happiness. B, depression. C, hopefulness. D, excitement. 85. Arthritis causes A, dementia. B, tuberculosis. C, constipation. D, stiffness and pain. 86. In diabetes mellitus, the pancreas does not produce enough A, estrogen. B, prolactin. C, insulin. D, progesterone. 87. Type 2 diabetes can also be referred to as A, adult onset diabetes. B, electrically charged insufficiency. C, childbearing diabetes. D, all of the above. 88. Paralysis on one side of the body is called A, hemiplegia. B, aphasia. C, quadriplegia. D, dysphagia. 89. Risk factors for cancer include the following except A, poor nutrition. B, water. C, radiation. D, tobacco use. 90. A brain disorder that affects a person's ability to think and communicate clearly is called A, anemia. B, AIDS. C, paresis. D, schizophrenia. 91. Which of the following practices are accepted during housekeeping? A, being organized when performing tasks. B, maintaining a safe environment. C, familiarize yourself with the household's cleaning materials. D, all of the above. 92. Cleaning of the kitchen should be done A, once a day. B, at night only. C, after every use. D, once in a week. 93. Which of the following is an example of a detergent? A, soap. B, iodine. C, kerosene. D, anion. 94. The process of giving special treatment to items that have heavy soil, spots, and stains before washing them is called A, retreating. B, escalation. C, retouching. D, pre-treating. 95. Which of the following would be the reason for changing bed linens? A, the sheets are wrinkled, making a client uncomfortable. B, the linen was used by another client. C, the linen is damp or unclean. D, all of the above. 96. The process by which nutrients are broken down to be used by the body for energy and other needs is referred to as A, reproduction. B, metabolism. C, excitation. D, lysis. 97. There are blank nutrients needed by the body for growth and development. A, 3. B, 2. C, 6. D, 4. 98. Foods high in sodium include the following except A, bacon. B, ham. C. Sausage. D. Orange. 99. The state of being frightened, excited, confused, in danger, or irritated is referred to as A. Stress. B. Joy. C. Mood change. D. None of the above. 100. Blank occurs when a person does not have enough fluid in his body. A. Dehydration. B. Fluid overload. C. Crackles in the lungs. D. Water toxicity.